Well, good afternoon, Mr. Chair, Mayor, Council members, Chris Shorter, Assistant City Manager. Really appreciate the opportunity to be able to talk about homeless response in Austin. I know it has been a while. Many of you have actually said it today since we had the opportunity to come before you in the public and talk about our homeless response system and the work that has been done and is being done. So again, really appreciate, Mr. Chair, the ability and the opportunity to come before you. So thank you for that. I also want to thank just the team within the city of Austin, particularly Bella Carmen, the interim homeless services officer, for her just continued efforts to coordinate and communicate and make sure that our partners are aware and that we are aware of what our partners are doing. All of the staff within APH and really the team across the city. Just thankless work and continued work as we will see throughout this presentation. I have to acknowledge and also thank Malika, who is on the line, and the team at ECHO, who have been just extremely dedicated and have been working with us really hand in hand throughout this pandemic. To respond to COVID-19, but also to continue to do the great work that our teams do every day. And so to the providers who I'm sure some of them are watching, thank you for your work and hope to see some of that reflected in the presentation today. Thank you for pulling the slides up. We could advance to the next slide. What I'd like to do is quickly go over the agenda. This is a very comprehensive agenda. Hopefully we'll go through it and have time at the end for questions, but hopefully many of your questions, especially those things that you mentioned in your opening that you wanted to hear, I think many of those things we actually have covered in our remarks. So that said, we're going to start with really an overview of the homelessness framework. This framework won't be foreign to any of you, and certainly to the public. We have, for the last few opportunities we've had before you, showed and displayed really this puzzle piece of a high-functioning homeless response system and what that system looks like. It was introduced to us by our consultant team, and Matt Doherty is going to talk a bit about the framework and how we look in terms of response today based on that framework. We'll then move into investing in results implementation. So we'll have Stephanie Hayden talk about performance-based contracting and the city and ECHO coordination around MOUs, RFAs, and contracts. Malika will then come in and talk about the P3 composition and priorities. We talked a bit about the P3 before, but I'm happy to have Malika join us to talk about P3. Then we'll go right into our priority area updates. And so we'll start with Rosie Truelove to talk about housing and to give an update on our housing programs. We'll then have Michelle Miles and Pete Valdez talk about homeless services and the sort of basic needs services that are happening every day in the city. Laura False will then start and give an update on communications and all of the outreach work that's being done from a communications and engagement perspective. We'll then have Assistant Chief Chacon and Andy Hoffmeister talk a bit about public safety and give an update there. And then finally, Ken Snipes will provide an update on public space management. Stephanie Hayden will then come in terms of recent accomplishments and near-term actions and talk about system-wide partnerships and city investments. So hopefully there we'll be able to answer some of the questions, Councilmember Alter, that you brought forward in terms of our allocation. And then finally, Perry O'Connor will talk a bit about the MyPass program, and I will wrap up with some of the near-term actions we've taken around public space management. So again, a very healthy agenda, very comprehensive. We'll move through as quickly as possible and hopefully have time for questions for things that were not answered during the presentation itself. So that slide said you could advance. As I mentioned at the top of the call, in spite of, and in some cases because of this pandemic, we have been, as a system, both within our government and our community partners and providers, have been working to do what we always do, and that is making sure that we are serving the population of folks, residents who are experiencing homelessness in Austin, but at the same time have been responding to what has been this intersection of homelessness and COVID-19, an emergency situation. And so what we want to do first is really give you a sense of, in spite of all of that, some of the progress that is and has been made in 2020. Next slide. And so many of you know that currently there are 29 violet bag kiosk locations in the city of Austin. Next slide. Of those 29 kiosks, 22 were created, or I should say established in 2020. Next slide. We also have 37 clients at our Violet Keepsake safe storage facility, which was opened again in 2020 and is, unlike previous efforts, has seen some amazing progress in use from our residents experiencing homelessness. Next slide. Happy to say that 530 residents experiencing homelessness have accessed temporary emergency shelter at Prolage in 2020 during this pandemic. Next slide. The number is growing. 1,387 individuals have moved through and exited our homeless system. And I'm happy to kind of talk about that a bit more, and very happy to have Matt Malika on the line to give context as well. Next slide. And then a number that many of you know, 500,000 plus meals have been served to individuals experiencing homelessness throughout this pandemic. A huge testament to you as council members who have really focused on making sure that we have the necessary funding and support to provide these services. So again, homelessness, just a snapshot really of some of the major accomplishments that have been made and lives affected by the response efforts being made by city staff and our community. All right, next slide. We'll now hand it off to Matt Doherty, who will talk a bit about our homelessness framework. Matthew.
Great, thank you, Chris. And Mayor, Chair, and council members, it's really an honor to have another chance to meet and speak with you all, and happy to have time to join with staff in this presentation. So we thought it would be helpful to just do a quick overview, reminder of kind of the framework that increasingly the city, ECHO, other partners are thinking about the work and the way to respond to homelessness systemically and systematically. And so really thinking about this work as having 4 distinct but intersecting components, and recognizing that there's responsibility for work that cuts across many different systems and sectors. And do think that this framework provides an effective way to both think and respond and plan the strategies, but also to talk and communicate about the work and to help the public think through what element of work is being tackled through different programs and services, and what are the outcomes that that kind of work might be able to accomplish. Further, the Investing for Results report that we've spoken several times along the way about use this framework to help think through the nature of the response that needs to be strengthened for the community and organize recommendations for activities using this framework. It has 4 essential elements. Just going to very quickly go through those. First element focuses on reducing inflow, so reducing the number of people who are experiencing crises and falling into homelessness every year. Oftentimes this work really involves work well outside of the homelessness response system, but are other public systems, other programs that can be more attentive to the needs that people are experiencing around housing stability, can intervene to prevent homelessness while people are being served by their systems or are exiting those systems. I think this, getting back to some of the earlier conversation, this is part of where some of the history and policy and failures of these systems to address housing needs results in experiences of homelessness. And it's also in this area of work, I'd especially highlight that many times the racial inequities that we see among people experiencing homelessness are the result of inequities within these systems and a lack of attentiveness to housing needs for people while they're receiving services through these systems. The second two elements of the system are very closely interrelated: crisis response and housing stabilization, with crisis response really focusing on identifying people experiencing homelessness and addressing their immediate needs, their immediate health and safety needs, their need for shelter, their need for access to food, their need for access to health care, with housing stabilization really being the element of the system that focuses on exiting people from homelessness, but needing to balance those two interventions so that we're addressing people's immediate needs while also putting them on a pathway for exits out of homelessness that are lasting and successful. Here I would highlight that the work of the city, and especially Austin Public Health, but also other city departments, and the work of the Continuum of Care and ECHO's leadership of the Continuum of Care really have shared and joint responsibility for these elements of this system, and share responsibility for making sure there's a strong crisis response system and a strong focus on housing stabilization and strong outcomes in that area. And then the final area, the final component is on inclusive public space management. Several of you have already raised issues around this already, but really trying to balance the needs for everybody in the public to be able to have equitable access to public spaces, but also to address the impacts that people experiencing homelessness may be having on public spaces, but in an inclusive, person-centered way that focuses on their ongoing needs for health and safety and protective measures, while crisis response and housing stabilization systems respond to those needs. Next slide, please. So this slide visualizes many of the things that you're going to hear updates and reports about from staff to follow, and how to think about organizing them within this framework of what element of the response to homelessness do different aspects of this work fall into. I think, again, it's a helpful way to both plan for where more work needs to happen along this framework, but also to communicate the wide array of strategies and activities that are underway and the different roles that those activities and strategies are playing within this comprehensive response to homelessness that's being built and constructed. So I think part of the intent of this slide is merely to help organize and show the vast array of activities that are underway, but also how those activities knit together into a systemic approach that over time can build the stronger system for reducing and ending homelessness in your community. There's only a few things. There's a lot of information on here, so I'm certainly not going to run through all of the programs and strategies and activities that are underway here. But I would just highlight a few things. For instance, the COVID-19 response clearly spans across both crisis response and housing stabilization. And I think early in the response, really the primary focus being on crisis response and the health and safety and protecting people who are experiencing homelessness, but now increasingly focused also on the housing stabilization needs of people who may have entered pro lodges or being served through other systems, so that we're balancing both of those things even within the COVID-19 response. And the pro lodges cut across both of those of providing the protective, but increasingly also having resources to exit people successfully from the pro lodges. And then I would also just highlight that some of the elements of the work you're going to hear today really are about the system overall and really underpin work across all of these areas, including the work around strengthening contract performance management strategies and activities, and the work that's underway to really strengthen the partnership between the city and ECHO and to get to greater clarity on roles and responsibilities, especially because there are so many areas in which there are shared responsibilities for both the city and ECHO and the continuum of care. And then you'll hear a lot about some of the work related to public space management and some of the activities underway in that area. So again, I'm just trying to help people think through all of the different work underway in a way to see it as a systemic approach of piecing together all of the pieces of the puzzle that build a comprehensive and effective system for responding to homelessness. Now I'm going to turn it to Matt Malika, the Executive Director of ECHO, who's going to talk a little bit about the COVID-19 response and some of the team structures that are in place to help lead and manage that response.
Great, Matthew, thank you very much. And I want to also express my gratitude for having the opportunity to address the committee today, and to thank our partners at the City of Austin and all the work that's gone into trying to help and protect people experiencing homelessness during the pandemic. And I want to also thank Matthew Doherty for his, his passion and history of work, and also all the work coordinating us here in the community that he's done. It's been really fantastic, and I think helped us put a framework together that's going to be impactful for years to come. So thank you very much. You can advance the slide, please. So I'm going to go over the project management team, which is a team that was put together in response to the pandemic, COVID-19. I think, as we all know, the pandemic has highlighted now more than ever why access to quality, affordable housing and healthcare should be human rights. And until we are guaranteeing those rights for everyone in our community, we are going to be addressing, public health and public safety needs of people experiencing homelessness, certainly unsheltered homelessness. So please advance the next slide, please. So we knew right away, very quickly after the pandemic hit, that it was disproportionately impacting people experiencing homelessness because of their lack or inability or lack of access to the things that would keep that we know to keep people safe from COVID. So that's the ability to social distance and to quarantine if you have symptoms or are symptomatic, access to hygiene and hand washing, and quality, affordable food, and all the things that many of us take for granted. So quickly we the City of Austin and ECHO worked with the many of the city consultants at the time to stand up this implementation structure that you see on the slide. So the project management team is a team that's composed of leadership at the city manager level and at ECHO. And the work of the group is to help to strategize and move forward the work of the implementation teams and the overall strategy around the pandemic response for people experiencing homelessness. So as you can see, currently there are 4 implementation teams that the project management team is overseeing. That's the hotel, motel implementation team, or the that deals with the services and operations provided at the pro lodges, the emergency shelter and unsheltered implementation team, which was really focused on the initial response to get folks assessed that were experiencing unsheltered homelessness and referred to protective lodging if they fit the criteria for referral, and then also helping the emergency shelter providers provide safe, reimagined emergency shelter, given that congregate shelter space, as we all know, was not the safest during a pandemic. There's also the funding strategies implementation team, and this team is focused on looking at how to get the funds that are coming into our community for the COVID response allocated and encumbered, and how to get the money out the door to serve people experiencing homelessness as quickly as possible and to have its greatest impact. And then the rehousing strategies implementation team is the team that's looking at how exactly are we going to be moving people out of the pro lodges and into permanent housing options in our community. So right now we're at sort of a nexus point with some of the teams as we're moving from, as Matthew said, from managing it as a crisis to managing it and being proactive with our housing opportunities, moving people out of the non-congregate shelter space and into permanent housing options in our community. So these teams are starting to take a little bit of a new function and role, and the project management team has been working over the course of the last couple of weeks to redefine and reimagine some of the teams and sort of refocus their charges moving forward. So some of these teams will take on a little bit of a different iteration over the next couple of weeks as we start to work really hard and diligently on putting the funds that are coming in through the stimulus, the CARES Act funding in play in our community, and having the greatest impact on people experiencing homelessness at high risk of COVID. So next slide. So I believe right now I'm going to be passing it off to Director Hayden for some more updates on the COVID response, and I'll be back to discuss P3 in just a minute.
Thank you, Matt. Good afternoon. I'm Stephanie Hayden, Director of Austin Public Health. And I know earlier today, ACM Shorter recognized Bella Carmen. And so I am sitting in for her today. And we really appreciate her leadership during this time. She has done an exceptional job during this process. As you all know, we are continuing to be in the middle of a COVID response. And one of the things that we really thought was really important for us is to have an asset in our community, which is our isolation facility. And so this is a facility where individuals can isolate or quarantine. So either while they are waiting to test, waiting for results, or after they have tested positive for the coronavirus. Individuals that need the isolation or quarantine will be able to use this facility, but we have also set up protective lodges. And so these protective lodges are for high-risk individuals, and we are using guidance from the Centers for Disease Control to provide additional protective lodging for individuals. Currently, we have 5 pro lodges that are open. All are at near capacity. So we have roughly about 320 guests that are there, and it's been a one-stop shop. So individuals, we've provided food, we've provided behavioral health support. We've had case managers from our various partners that have come in and continue to work with the individuals to case manage them. We had folks come in to assist folks to register to vote. And we're also going to provide some flu vaccines while they are there. To date, we are really excited because as of today, 42 individuals have exited from the protective lodges into permanent housing. As far as testing, we have a partnership with Community Care and Dell Medical School. And we are providing periodic testing for persons experiencing homelessness and the service providers. And so we've tested over 728 individuals have tested with a little bit, about a 0.5% individuals that have tested positive. We continue to test at the at the clinic that is located at the Arch there. And then we have several locations across the city that we are testing. Now that testing is for individuals that are symptomatic and are asymptomatic. So for example, with our last bit of testing where there was 100 individuals that were tested in the downtown area, there was 1 individual that tested positive. As Matt stated earlier, with our CARES funding, we have our emergency solutions grant that we are working with, which has allowed us to provide that additional support for individuals that are exiting the pro lodges, as well as being able to provide some targeted funding to additional individuals that are at the protective lodges. Our downtown Austin Community Court is providing some case management services, as well as our Salvation Army, Front Steps, and Caritas are some of our partners that are going to continue to work with us in order to ensure placements are made. Our folks are continuing to do outreach across the city, including our past folks that are employed by Integral Care, our host team, and our groups are providing some employment services. At this point, I will turn it back over to Chris Shorter. I'm probably not saying the right person. Who's next after me?
Well, that's okay. No, you Stephanie, you're fantastic. Let's get to the next slide. We're going to have Nat, Malika talk a bit about free, and then Stephanie, you could jump back in to give the additional.
Yeah, thank you.
Okay.
Thanks very much. So I want to talk a little bit about the P3 initiative that was highlighted in a previous slide that Matthew Doherty spoke on. But really what's been put together to address the needs of our need to scale up capacity in our community with all the new dollars that have come in. We've looked to this P3 initiative to take on the task of working to identify needs through the providers of how to get this money out quickly, what program interventions we should be focusing on, and what the needs are from the provider community in order to best address and get money out to them so they can scale up their program. So the P3 public-private partnership is a group that is co-convened by ECHO in the city of Austin, that has leadership from many of the local service providers, as well as the Downtown Austin Alliance. So we have Caritas, LifeWorks, the Salvation Army, Front Steps, and Integral Care, as well as the DAA as part of that group. And the charge of that group is to try to focus on how to scale up and provide more robust programming that ends people's homelessness. And so when we talk about housing programs that work to end people's homelessness, we look at permanent supportive housing, we look at rapid rehousing, we look at diversion, and we look at emergency shelter as options across the continuum. And this group is looking to address how to build capacity in those areas in our community. The first area that this group chose to address is through rapid rehousing, and that has a lot to do with the fact that we have about $10.5 million of rapid rehousing money through the ESG CARES Act. That's both money from the City of Austin and through the Texas Department of Housing and Community Affairs that needs to be RFP'd out to our providers and used to end homelessness amongst people who are experiencing homelessness and impacted by COVID. And so that is a substantial amount of new money to our community that I think, a lot of communities are facing. How do you get that money out into the community? How do you do it well? How do you help providers in the community scale up the resources and the services that they're already there to provide to create new capacity in the community? And so that is the first task that this group has taken on. And more, I think, than anything else, bringing this group together has been, beneficial for all of our providers and ECHO in the city to be together to really define the roles of ECHO in the city and how we're going to work together with the providers and get them the resources they need to end homelessness in our community, because it's the providers, the service providers in the community that are going to end homelessness, and ECHO and the city of Austin as a partnership need to make sure that we are there to help them scaffold the programming out, that we're there to provide resources, and that we're there to provide support in a meaningful way. And that's what this group has been brought together to do. This group is also going to be looking at diversion and permanent supportive housing in the near future, and how we're going to really impact the housing stabilization component of the 4 puzzle piece system that Matthew presented on earlier in the presentation. And that component, as you all know, is crucial to ending homelessness in our community, bringing the right housing and the right services to people to end their homelessness. And so that's what that group is focused on. The Rapid Rehousing group is meeting weekly now, I believe. And the P3 group comes together once a week to sort of work out the high-level vision for our housing stabilization component of our homeless response system. And I'm going to pass it back to Director Hayden, who I believe is going to go through performance-based contracting, City of Austin and ECHO coordination, RFA contracts and MOU, and the Homeless Strategy Officer.
Thank you. Thank you. Austin Public Health has been managing new and ongoing contracts with over about 20 organizations. And they're on a continuum. So whether it's homeless prevention, outreach, navigation, emergency shelter, rapid rehousing, permanent supportive housing, supportive employment, behavioral health, and other services to our neighbors that are experiencing homelessness. One of the recommendations was performance-based contracting. And so as our staff continue to work on this, we are going to plan and implement a pilot project. And so with this pilot project, we are going to do a engagement process where we're able to receive feedback from the community to inform us of the provider community about our plans to do this process, and then collect that information from them. As a part of the work, we're going to also do some additional research. And then from there, we're going to start the pilot process. This gives us time to run the pilot, but it also will allow us an opportunity to analyze and report and provide a report back to city management as well as mayor and council. Our solicitation, we've pushed it back a year, and we adjusted it because of the pandemic. But this will allow us the time to implement and move the pilot through, gather that information from that. And then from there, the new contracts would start October of 2022. As far as our investing for results, we have worked very closely with the city and ECHO to really clarify our roles. We've established a policy for systems design. We have looked at a strategic process for unsheltered and encampments. We've continued to collect and analyze data to inform further system refinements. And then the communication with homelessness assistance has really been, has moved to the next level in order for us to provide those partners and the community at large that information. We have started coordinating a funding and program design effort for rapid rehousing and prevention services. We've used our CARES Act ESG and our CDBG funds, and we've issued 2 joint competitive solicitations. We are finalizing a contract for ECHO to continue to serve as our continuum of care lead agency and HMIS database administrator. And they've served in that role for quite some time, but we want the contract to be more reflective of the work that we've worked together to negotiate the terms of this agreement. We're working on an MOU to establish agreed upon roles and responsibility for greater coordination, accountability, and transparency. As you may know, with the Homeless Strategy Officer, that position moved over to the health department. We have established a homeless services division. And within that division, we have individuals that are providing support and working in the various areas to assist the homeless strategy officer. We are working with a recruiter to hire the homeless strategy officer. We plan to conduct interviews next month, and we will hire a person that will move into that role. Just as a reminder, we know that a position where the individual has a significant amount of coordination across the city. However, as you'll see later in our presentation, we still have significant leads across the city that all come together to be supportive to this homeless strategy officer. And that completes my section for now, and I'll transfer back over to Chris.
Thank you, Director Hayden. As we move our priority leads in and move Stephanie, Matt, and Matthew out, just want to really remind the listening audience and certainly remind council members that based on just a few slides ago, our discussion around the Investing in Results report and all the work that the consultant team did, that these elements are very core to us implementing that work. So we are truly building a system that has the capacity to serve our homeless population and truly make homelessness in Austin rare, brief, and non-recurring. Do we have our priority leads in at this point?
I think I'm up first, Chris, and I'm here.
All right, you could advance the slide. Right, go ahead, Rosie.
Good afternoon, Rosie Truelove. I'm the director of the city's Housing and Planning Department. I'm going to brief you on a number of different items, starting with our tenant-based rental assistance program. Housing and Planning will be executing a new contract for tenant-based rental assistance with HACA, the Housing Authority for the City of Austin, in December of 2020. In the past, we've had multiple contracts with HACA to administer our TBRA program, but in the new fiscal year, we are combining these into one contract for efficiency. The $1.1 million contract will serve approximately 85 households. These households will be referred by agencies such as the Salvation Army, Caritas, and will prioritize households coming through the coordinated entry system. The existing contracts will be extended through the end of November, with the new contract beginning December 1st. I want to highlight some of our partnerships that the Housing and Planning Department has entered into with respect to ending homelessness. We have existing contracts with ECHO, with Family Elder Care, and with HACA. These consist of the TBRA contracts that I just spoke about, a low barrier permanent supportive housing rental voucher contract, as well as a professional services consulting contract with ECHO. And we recently executed a new contract with Family Elder Care to administer $1 million of Community Development Block Grant COVID funds to provide emergency rental assistance to households at risk of homelessness as a result of COVID-19. And in addition, we are planning for a local housing voucher program, which I will discuss more in a few minutes. We regularly collaborate with other departments such as health and other agencies such as Family Elder Care, Caritas, Front Steps, and others in regards to COVID-19 planning and programming. And our Housing and Planning Department staff and Austin Public Health are members of ECHO's membership council. I wanted to provide an update on the motel conversion strategy. Housing and Planning is working with the Office of Real Estate Services and Health to identify existing hotel properties that can be converted into housing opportunities. The process includes property identification, due diligence, and purchase negotiation. A former Roadway Inn hotel was purchased in May of 2020. It's located on the access road of IH-35 between Woodward Road and Old Horse Street. And renovation began soon after purchase, and the hotel is now functioning as Pro Lodge 5, housing homeless that are at risk to contract the COVID virus. A second hotel, the Country Inn and Suites, closed last week. The hotel, which includes 75 rooms, is located in District 4. The property will remain effective as a pro lodge for approximately 3 to 6 months to facilitate the transition to permanent supportive housing for that facility. A third hotel in Northwest Austin is in the due diligence phase, and final decision to purchase will follow shortly after we complete our due diligence. And so more information will come to the full council as that gets further along in the process. Wanted to highlight a little bit about our Rental Housing Development Assistance Program. That's the RHODA acronym there on your slide. One project that we're particularly excited about is the Aspero at Rutland, Aspero Austin at Rutland. The Austin Housing Finance Corporation authorized a loan in an amount not to exceed $2.5 million for a multifamily rental development to be known as Aspero at Rutland, to be located at or near 1934 Rutland Drive. The project will be developed by a partnership between Caritas of Austin and the Vecino Group. Caritas of Austin has a mission to prevent and end homelessness in Austin, and for the last 14 years has operated supportive housing through various leasing partnerships across the city. The Vecino Group is a national developer of mission-driven housing with 23 active projects in 12 states, including 18 supportive housing developments. Austin Housing Finance Corporation will be utilized for development costs of 171 units of deeply affordable rental housing. This project will help advance the city's goal of increasing housing stock available for permanent supportive housing, as well as rapid rehousing programs. 101 of the apartments will be set aside for households experiencing homelessness, as referred by ECHO, and of those units, 44 will be restricted to individuals experiencing long-term homelessness. 27 units will be available for households earning at or below 30% median family income, and 117 will be available for households earning below 40% MFI. 27 units will be available at 50% MFI, and all units will be efficiency apartments. The developers will be pursuing low-income housing tax credits, and construction will optimally begin in late 2021, with units becoming available in 2022-2023. I wanted to update the committee on our local housing voucher. As part of the Housing and Planning Department's fiscal year 2020-21 budget, City Council approved $3.6 million for a local housing voucher program through our Affordable Housing Trust Fund. Housing and Planning staff is working with a consultant and stakeholders to create a program that will work seamlessly with local homelessness efforts and best leverage existing financing programs such as low-income housing tax credits. It is anticipated that the local housing voucher will provide sufficient funding each year for between 250 and 300 people experiencing homelessness. The local housing voucher will be structured as a project-based subsidy that will be dedicated to housing that provides ongoing social services in a low barrier, no barrier environment, serving the highest priority individuals through the coordinated entry system. And it's anticipated that this will come, that the first local housing voucher contract will come forward in December 2020. A few other highlights for the Housing and Planning Department. We recently launched, as you all know, the second phase of our Rent Relief of Emergency Needs for Tenants program. This program is providing rental support for low-income households who have been financially impacted by COVID-19. To date, there have been nearly 5,400 completed applications, and applicants reported average current income of $14,639. $14,639. Of applicants to date, more than 77% are extremely low income, earning less than 30% of the area median family income. The program's eviction prevention services, such as increased landlord-tenant mediation and legal representation in court proceedings, will be crucial tools ensuring that Austinites don't face the mounting wave of evictions that have been predicted. Contracts will be in place for these eviction prevention services this month, and the rent program will prove to be impactful in the city's effort to stabilize tenants and prevent families from moving into homelessness. And then lastly, Director Hayden already mentioned some of this, but I wanted to reiterate that in addition to continuing to manage the pro lodges and isolation facilities, APH is administering our ESG CARES dollars. As part of the CARES Act, $4 billion was included nationwide for emergency solutions grants through the U.S. Department of Housing and Urban Development. The City of Austin received notification of the first allocation of $2.3 million, and City Council approved acceptance of this grant to prevent, prepare for, and respond to coronavirus. among individuals and families who are homelessness or receiving homelessness assistance, and to support additional homeless assistance and homelessness prevention activities to mitigate the impacts created by coronavirus. The state of Texas was also notified of a first-round allocation through the Texas Department of Housing and Community Affairs and designated a little over $1 million for homeless services to Austin Travis County through the Ending Community Homelessness Coalition as the coordinating entity. The City of Austin and ECHO released a recent joint solicitation for rapid rehousing services targeted for guests at the Pro Lodge, and city and state contracts are being finalized with service providers. Program staff are being hired and services will begin in the coming weeks. On July 22nd, HUD announced a second wave of ESG funding in the amount of $10.8 million to the City of Austin, and HUD released requirements and guidance for this funding on September 1st, and planning continues to be underway for these funds. And that's the completion of the Housing and Planning Department's overview.
Thank you. Thank you very much. We'll move to the next slide, please. So we're going to have Michelle Miles start us out, and Director Valdez will.
Good morning, everyone. My name is Michelle Miles. I am the acting program manager with the Homeless Services Division, and I will be providing part of the homelessness updates. Meeting Apart initiative is a COVID-19 emergency response to food access issues that resulted from the impacts of COVID-19 on people experiencing unsheltered homelessness. As mentioned earlier in the presentation, more than half a million meals have been provided to our unsheltered neighbors. These consist of prepared and shelf-stable meals. The Homeless Services Division partnered with multiple city departments, Travis County Constables Precinct 3, local nonprofits, faith-based organizations, and volunteer organizations to get food out to the entire homeless community. The EAT initiative used two strategies, providing prepared meals that went to areas that normally provided meals to people experiencing homelessness pre-pandemic, but who experienced service interruptions. Community partners also delivered meals to people living in encampments. And these are the shelf-stable meal bags. And each meal bag contains 7 days of provisions for people to encourage them to adhere to public health guidelines to, at the time, shelter in place and also limit the spread by reducing interactions with other people. In addition to the food provided, water was provided, toilet paper, face coverings, hygiene items, health and other informational material, and pet food as needed for our pets. We utilized two shelf-stable meal providers, Central Texas Food Bank initially for the first couple of months, and then subsequently we partnered with Cisco through a contract with Austin Public Health. Prepared meals were provided by Revolution Foods, and more recently we pivoted to working with Good Works Austin, a local nonprofit that works to ensure that local restaurants are keeping people working, and they pay a living wage of $15 an hour. We also worked with Good Works Austin to ensure that the food provided would meet the needs of our unsheltered neighbors. Regarding safe parking, we're exploring safe parking options. The Homeless Services Division, along with the Office of Design and Delivery with the City of Austin, met with a representative from New Beginnings Safe Parking and Counseling Center in Santa Barbara, California. The safe parking model that they utilize there is quite unique. It's more of a stealthy model. They partner with the county there, the city, and local churches and private entities to get a small portion of parking spaces available in their parking lots. And for this program, all the cars have to be registered and in working order, and individuals have access to case management, and there's also roving security that go between locations. What we've noticed recently is that there have been some people who are experiencing homelessness who are sleeping in their cars within the city of Austin. And during the census, it was identified that 60 individuals were sleeping, or 60 cars were identified as containing people experiencing homelessness. Regarding equity, the City of Austin and ECHO participated in a 5-week HUD-sponsored system performance intensive workshop. And during this workshop, we picked a certain area to study, and Austin, we picked equity and the coordinated entry. Coordinated entry, equity issues was being investigated previously by the continuum of care, but we took a deeper dive into looking at the ways in which we can slice and dice the data regarding equity issues and coordinated entry. The Homeless Services Division and ECHO are seeking a more equitable homeless response system using data-driven solution, and not only at coordinated entry, but through the different intercept points within the homeless response system, because equity issues occur at every entry point, and we want to ensure that we're addressing all of the issues that can contribute to causing inequities within our system. Regarding the Pro Lodges, as mentioned earlier, is working on rehousing efforts within the guests that live at the Pro Lodges. We are holding 3 meetings a week to discuss rehousing individuals within their Pro Lodges, and we're utilizing a by name list. It's comprised of multiple service providers working collaboratively to come up with strategies to find stable housing for people at the Pro Lodges. Regarding outreach, Integral Care's PATH outreach team has expanded due to new funding the past 2 years for 4 additional team members, which is very needed for our community. Our community needs a lot more homeless outreach providers. Through the work of the EAT initiative, our community partners have identified the need for more robust outreach efforts within the community. The Homeless Services Division is partnering with ECHO to discuss enhancing Austin's outreach strategy to develop a community-wide initiative to improve the health and safety of the entire community, leading to ending homelessness. Regarding our cold weather shelter planning, most of our cold weather shelter partners are not able to participate in cold weather sheltering this year due to the nature of COVID-19. A lot of the partners are churches and faith-based organizations, and a lot of individuals who volunteer to work at the churches for cold weather sheltering are older adults with health issues, and this puts them at higher risk for negative health outcomes if they contract COVID-19. As a result, Austin Public Health has been convening cold weather shelter planning meetings, and an organization called Austin Mutual Aid has agreed to fill the gap and provide coordination, manpower so that we can activate cold weather sheltering when needed during the winter months. In addition, our Alamo Draft House has offered space to serve as a central hub for warehousing the items needed for cold weather sheltering, blankets, cots, food, things of that nature. The Arch and Front Steps, and the Arch, which is also Front Steps, and Salvation Army will continue participating in cold weather sheltering and planning. Regarding flu immunizations, as everyone knows, is very important for flu immunizations this year, in particular because of COVID-19 and possible compounding effects of being infected with the flu as well as COVID-19. As a result, the Homeless Services Division is partnering with Healthcare for the Homeless, Dr. Kwan's group of community care, to develop some immunization clinics for people experiencing homelessness. We're targeting the Pro Lodges, the Arch, the Salvation Army, Sunrise Church, and other locations to be determined. So we're very excited about the partnership and working together to make sure that our homeless neighbors receive flu immunizations. And the flu immunizations will also be made available to staff members as well. Regarding capacity building, the city has seen very few agencies applying for funds in recent competitions. So APH developed a brief survey to gauge interest. Survey responses from 45 plus service providers, faith-based organizations, nonprofits, and other groups indicated interest in partnering with the city to provide one or more types of homeless services. City staff will be reaching out to the providers to gauge their interest further. Austin Public Health partnered with several city departments, community partners to support the 2020 census count of people experiencing homelessness. This was a long planning effort, and the goal is to try to get a complete count of people experiencing homelessness so that we can get funding from the government. The city of Austin, as well as ECHO, are partnering to look into capacity building efforts for the homeless response system. And there is going to be a capacity building group that's going to be housed within a project management team structure. The areas of interest for this group could be pretty broad and diverse because there are many different ways that capacity could be impacted, and not necessarily in the same ways that you would traditionally think of. But some areas of interest would be rapid rehousing, as Matt and Malika mentioned earlier, permanent supportive housing, onboarding new housing units for people that are low barrier, looking at things such as master leasing, improving and increasing best practice training for people who are doing case management or homeless engagement work, so that we're utilizing the best practices to ensure that we're making those connections and building relationships with people who are experiencing homelessness to get them to engage in a homeless response system. We'll be looking at homeless prevention and an overall philosophy towards ending homelessness and iterating that knowledge, as well as partnering with our community agencies to ensure that is implemented. Well, that is the end of my presentation. I'm going to kick it back to Chris.
Thank you very much, Michelle. And Director Valdez, did you want to jump in now?
I am here. Can you hear me?